The information provided on Dr. Tom Rosell Live by Dr. Tom Rosell, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody, welcome. This is Dr. Tom Rosell. You're listening to Ageless Health, as you do all the time, every week, same old, same place. And we're going to get into some differentiating thought processes on why you have pain. And we're going to be talking about the difference between sciatica and what's called peripheral neuropathy. We've touched on both of them periodically, but there's some distinguishing features, and I really want you to understand them, because if you're suffering with a pain pattern, you really have to understand it. You can't fix it unless you know the why behind it. And as we've said multiple times, you've either had an injury that's never gone away, or your body neurologically is remembering that injury, or there's a biochemical something or bioelectrical onslaught that continues the process, or simply that your stress level is over the top, or a combination of all those things. So let's get into it. And by the way, all of this is leading into a program coming up on the 18th of February at the Rosell Center in Fairfax, Virginia. So if you're anywhere near the area, we'd love to have you as our guest. All you need to do is call the office at 703-698-7117, 703-698-7117, or go to rosellcare.com or drtomrosell.com. And by the way, while you're there, just because it's a fascinating place for you to go to the top toolbar and check on our online store. It's called Ageless Health Store, and you click it, you go into it, and we're going to have all kinds of things that are set up there for you. We have air tamers, but we also have a site that you can buy nutritional products that we recommend. And there's 4 of them that are sitting there that we recommend to keep yourself strong during this crazy flu and crazy enteroviruses and so forth. I have my staff take one of each one of these every day. So make them yours. I take them as well. So make sure that you're protected. Go online, go to agelesshealthstore.com or go to agelesshealthrosellcare.com, and it's all there. Pick them up, order them, and I promise you're going to be a whole lot healthier because of it. Let's get into the program. We're talking about pain, and pain in your lower extremity, in your leg, and so forth. So that pain down your leg, there's a differentiating condition between neuropathy and sciatic nerve pain. The first thing is the location. Neuropathy refers to damage of the long nerves that go from the spine all the way down into the extremity, your legs, if you will. They can go into your arms, they go other places, and especially involves pain originating from different types of bundles of nerves, long nerves. The sciatic nerve, if you will, is 5 nerves, not just one. They come together as a group. So does that neuropathy refer to the sciatic pain, or does it refer to something else? Okay, so let's pick it apart. We said neuropathy refers to damage of the long nerves, the peripheral nerves, and it could be in your arms, it could be in your legs, but we're distinguishing right now the difference between pain in your leg, called sciatic pain, and pain in your leg from a peripheral neuropathic condition of some sort. And we'll get into that. We'll touch upon that a little bit more. So the sciatic nerve, which is the longest bundle of nerves in the body, and it goes, by the way, the nerve that is the longest is the 10th cranial nerve. We're talking about spinal nerve roots here. So the cranial nerve, the vagus nerve, the 10th cranial nerve goes down and touches every organ system in your system. This touches every nerve or every muscle in your leg and so forth. So neuropathy can come from a whole lot of different conditions. You have to rule out diabetes. You have to rule out infections, chronic infections, even viral infections, even parasitic infections, and toxins. What kind of toxins? Well, we're talking about things like, mercury and aluminum, and we're talking about other things that you're exposed to on an ongoing basis. Arsenic, if you ever had any of those MRIs where they inject you with contrast, we're going to put contrast medium. Well, that's barium, and it causes an issue long-term in your body that can cause the nervous system to break down. And we'll get back to that a little bit. We'll talk a little bit more about what these things are. So a neuropathic pain, if you will, can come about from any of those things, whereas sciatic pain is typically as a result of pressure on the sciatic bundle. Remember I said it's 5 nerves, not just one. And it can due to a herniated disc in your back. It could be a muscle that's not working the way it's supposed to. It could be an off-centering of one of the spinal bones. It can be degeneration, spinal stenosis. All those things can cause a sciatic problem. Now, symptoms are interesting to distinguish any kind of condition. So you have to look at things like pain and tingling and numbness. Neuropathic symptoms are, if you will, static. That means they're there all the time. Well, sciatic symptoms can fluctuate. They can fluctuate with movement. They can fluctuate with physical activity. They can fluctuate with different posture positions and so forth. So let's differentiate that again. A peripheral neuropathic pain, no matter where it is pain that can be sharp, intense, tingling, numbing, can't feel anything. But neuropathic symptoms are stable. They rarely go away. Position doesn't change them. They're always there. Sciatic pain can fluctuate based on the position that you're in, how you take pressure off, whether you have your legs up, whether you're standing or sitting. If it changes the pain itself, then it goes down. Now, remember, with sciatic pain, it goes down the back of your leg and the side of your leg. It does not go down the front of your leg. That has nothing to do with a sciatica. Sciatica comes down from your butt all the way down the back of your leg, into your calf, into your toes, over the top of the front of your foot. That is a typical sciatic pain. So if you're dealing with that kind of thing, or even from the knee down, but it goes to that course, it can be problematic. Now, neuropathy can affect all kinds of nerves throughout the body. Well, sciatic pain, as we said earlier, only affects the back and the legs. Understanding these differentials, my friends, will give you specific details on how to treat these things. Because if you don't understand where it's coming from, you can't fix it. If you can't understand the cause, you can't fix it. Then you're what? You're susceptible to take these pills and let's see if we can control the pain. Or, let's inject it with a steroid. Let's see if we can control it that way. Neuropathic pain is one that is very, very specific. So neuropathy and neuropathy symptoms have to be very specific and distinguishing from a sciatic pattern. All right, so let's get into it just a little bit more, and we get into what's really happening. I'm going to give you a couple of things that you can do to help that help things slow down, decrease the inflammation, and so forth. And so, when it comes to intervention, we have to decide whether we're talking about medical intervention, and that's pills and injections and surgery and so forth, and blocks and the like. Or can we do something else that will allow our body to free itself to heal from the tingling, the burning, the numbness, the pins and needles? And they can be in your legs and your feet, and it can be in your hands, by the way, as well. So here's the deal. Over 20 million people suffer from some sort of nerve pain continually. And that's hundreds of nerves that support the body, right? So if we have that type of situation going on, why is it that we're suffering so badly? Why is it that we have this damage that's taking place? Now, I want you to visualize a long nerve, almost like a wire. And we're going to distinguish a couple of things. I'm going to show you something right now that we're going to get into it a little bit later. But let me introduce you to my friend again. And we're looking at a spinal nerve, and it's peripheral pieces that come off like this. Here's the cord, runs all the way down inside these bones. And you see down at the bottom how it comes out like this is horse's tail. Well, it's called a caudae equini, horse's tail, and it's covered with a wrapper. That wrapper is made out of myelin, and it's called a myelin sheath. Now, the nerves can be damaged simply because this myelin sheath is being irritated in some way. And it can be irritated from, as we said earlier, mercury, aluminum, and so forth. So we're going to get more into that. I'm going to show you exactly how to distinguish differences and what you can do about it. And you better do something about it, because what happens is that if you let it go too long, you can result in permanent damage, both, by the way, from a sciatic pattern to the neuropathic pain that we're talking about. So here's the deal. Sciatica or peripheral neuropathy. We have to understand that the symptoms can be somewhat similar, but they're often extremely different. So if you go to the doc and you have pain somewhere in your leg, and the doctor can't distinguish the location or the origin, how can they even diagnose it? How can they tell you it's this versus that? You go in and say, oh, my leg aches, doc. It just hurts me terribly. And he doesn't ask you questions like, does it hurt when you go upstairs? Does it hurt when you go downstairs? What makes it better? What's the pain like? Is it burning? Is it stabbing? Is it electrical? Do you feel numbness anywhere? Can you get up on your toes? Can you get up on your heels? Those are differentiating questions that help him understand or her understand where the origin of the pain may be coming from. When you go to the bathroom, when you cough or you sneeze or you bear down in any way whatsoever, does that cause you pain? If the answer is yes, then we may be dealing with a disc, or we may be dealing with a spinal stenosis. Now, there are many different types of disc patterns that will cause that sciatic-like pain, but peripheral neuropathic pain is not separated because of its position. It's not separated because of motion or function. It doesn't come and go. Neuropathic pain is fixed, and that's what I really want you to understand. It's a fixed process. So we have to make sure that we understand what the difference, because if you don't treat it the right way, it's going to get worse. If you treat a peripheral pattern like a sciatic pattern, it's never going to go away, particularly if it's a diabetic pattern, or particularly if there's heavy metals, aluminum, mercury, arsenic, barium, that are causing the myelin, the wrapper around the nerve, to break down. So how does one go about distinguishing those things? And that's the piece that we're talking about today. So here's something that you could do, right? First, if you're having that kind of leg pain, where is it? Is it in the front? Is it in the side? Is it inside? Is it in the back? Is it all the way down the leg? So if it's not in the back from your buttocks going down, if it's not in your back, at least going down the outside of the leg and into the calf and into the foot, then by definition, it is probably not what? A sciatic pain, because we said the sciatic nerve comes from 5 areas in your back. They come together as a bundle about the size of your thumb, and then it goes down the leg. So it depends on which branch is being affected that will cause that distribution. Okay, now let's go into the more difficult one. Let's talk about the peripheral neuropathic problem. So we distinguished it already by saying what? We said that neuropathic pain is destructive. It's destroying the nerve. It's breaking down the wrapper, the myelin sheath. So what do we know that can do that? Well, when a patient comes in, one of the first things after I have a really good sense that it has to do with a neuropathic problem and not a sciatic problem, I'm going to say, hey, listen, over the years, have you had a lot of vaccines? Why am I asking that question? Because the adjuvants, the stabilizers that allow the vaccines to last for a long time are aluminum and mercury, primarily. Sometimes I'll ask people, where'd you grow up? And they'll say, well, Southern Virginia. What does Southern Virginia have to do with anything? Heavy what? Has to do with raising tobacco. Why is that a consideration? Because there's exposure to arsenic. If you're old school, how many of you had fillings that are mercury fillings? That's nickel, that's silver, that's mercury. 25% to 50% of that mercury is gone within 12 months. Where does it go? It goes into your body, and it can affect other areas of your body. It can affect the neuropathic platform, the covering, the myelin that we talked about that surrounds that area and protects it. So you have to distinguish what's going on. So how do you fix that problem? First, you have to understand where it's coming from. If you don't understand where it's coming from, you can't fix anything. And that's the most important thing that you have to look at. If it's not distinguishable from something else, and it's not localizable, meaning that it comes from a very specific area, you can't get rid of it. You're just going to numb the symptoms. You're just going to dumb down the irritation that you don't want to experience anymore. So here's what we're going to do. We have to begin to put it together, one piece at a time. Where's it coming from? How do we deal with it? And then we go from there. So let's talk about sciatic pain first, okay? And then as we go through the program today, we're going to really get into the depth of it. So again, let's recap. Sciatica is what? It's 5 nerves. Where do they come from? Your low back. What do? They allow for 2 things: sensory perception and also function, locomotion. So if locomotion is going to be involved in this, then if you're losing function, motorical function, no matter what you do, and there's pain that comes and goes down the back of the leg, from the buttocks down, into the heel, into the foot, outside, into the calf, and into the foot, into the toes, that's probably a sciatica. But now we have to find out which area of the spine is actually involved, okay? So if that's the case, and we don't do that, you're never going to get rid of it. You go in and you go to a physical therapist, and they're going to stretch this, and they're going to poke at that, and they're going to use this kind of therapy and that kind of therapy, but they're aiming it at the nerve and at the muscle. They're not aiming it at the cause, the origin, which could be spinal. If the vertebrae, the bones of the spine, are out of position, you could have a problem on multiple levels. But sciatica is very distinguishable. It's very specific. And you have to know what it is you're looking for. Does your doctor take a pinwheel and drag it down the course of your leg and try to find out where the pain levels are located? Because those are called dermatomes. Those dermatomes will give us a finger pointing to the spinal level. Does he do that at the bottom of your foot? Do they dig a reflex hammer? Do they ask you to walk on your toes or walk on your heels? If they're not doing that, then how can they distinguish where it's coming from? Everybody goes out and they want to do CAT scans and MRIs and things of that nature. How about doing just a set of old-fashioned x-rays, and you can see the height of the different vertebrae? That disc maybe has shrunken down, and it correlates directly to that nerve root. So how about neuropathic pain? As we said, it doesn't go away, right? But we're going to find loss of sensation. We're going to find exacerbation of pain if we touch the wrong areas. We're going to see that the patient is walking around almost like they're stamping their feet. It's really important that we understand the differentiations relative to where they're coming from, sciatica or peripheral neuropathy. And remember, on the 18th at the Roselle Center, we're going to go through that, and we're going to show you how to fix them. We're going to show you what to do. But today, as we go through the program, I'm going to give you some home fix remedies that will help you and tell you what you need to do. So when we come back after the break, we're going to get into some of the things that for neuropathic pain that you got to stay away from if you ever want to fix it. If not, you may lose a limb. You're listening to Dr. Tom Roselle. This is Ageless Health, and we're going to get into this much more in depth just in a few minutes. Don't go away. I'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody, welcome back. This is Dr. Tom Roselle. You're listening to Ageless Health with yours truly, obviously. And we're going to get deeper into the weeds here and talk a little bit more about the distinguishing factors, but also things that you can do to get rid of that leg pain, that numbness, that loss of sensation, the inability. Here's the deal. I want you to understand something. I've said it before, but I want to bring it out one more time. If you have anything that is compressing the sciatic nerve, or that is a true neuropathic problem that's coming from the low back, we have to remember that those nerves go to organ systems as well as going into distinct distributions within the body. So what else could it affect? Well, if you truly have a neuropathic problem or a disc that's pressing on a nerve root that comes from the L5 disc space, which is the last one in your low back. Let me show you that. I want to show you exactly what I'm talking about. So here's my buddy again, right? And so the deal is that these little areas here, these are all interspinal discs or intervertebral disc. And we kind of outline this one in a reddish color. But if I turn it this way, you can see this is a bulge. That's a disc slipping out of its position, and it puts pressure on the nerve that exits through there. And then it runs down the leg. Remember I said, take a look at this caudae equini as it goes all the way down and so forth. Well, it comes from up here too. But some of these nerves, right, they go through into the front portion of the body, and they go into the organ systems, the ovaries, the uterus, and so forth. But guys, into your testicles and into your scrotum. So if these nerves are irritated, either with a sciatica or neuropathic platform, guess what's going to happen? There are certain things in your body that is not going to work, or they're going to be painful. It's going to hurt. ladies, you could be suffering from painful intercourse because the nerves that are coming from your back go to the vaginal area. And now they become irritated, just like any other tissue. It's sore to touch. It feels like it's burnt. So when you are, with your significant other and the moment is right, you can't because you're afraid. You're afraid because it's going to hurt. It's going to hurt because that nerve coming from your low back is being irritated. It's either being broken down because it's neuropathic or there's compression on it because it's what? Because the disc is bulging and the disc is irritating. So let's get into a little bit more of this thought process because it's really important that you understand it, that you get what really is taking place. If we talked about neuropathic pain, right? And we wanted to distinguish, what's really happening or how to treat it and so forth. We have a history. The history is important. So when you go to your doc, he should be taking or she should be taking a very thorough medical history to identify anything that may be going on, any underlying conditions that may be contributing to neuropathy. So what are we talking about? We're talking about things like diabetes. We're talking about autoimmune disorders. We're talking about kidney diseases and so forth. They're very important when it comes to that because they can cause all kinds of neuropathic inflammatory responses that if we're not aware of where they're coming from, it's just going to continue to be a problem. Now, medications and certain nutritional supplementations that are taken, because if we are taking too much of a good thing, sometimes it's going to be an opposite effect. So what would do that? Well, any kind of steroidal medication that's taken over a long period of time, any kind of painkillers that are taken over a long period of time, they can cause the nervous system to begin to degrade, to begin to break down. And, they even know in the sports industries anymore that if you give any kind of steroid for an extended period of time, it'll become worse. So I would caution you, make sure you look up and your doctor looks up the side effects. And, the scary part is, unfortunately, a lot of our physicians who we dearly care about don't know the side effects of the medications that are out there because they're coming so quick. So many of them they're due to immune suppressive conditions, and they knock down your immunological supports. So what else could cause a problem? If you're taking something that's a blood thinner, but way, way high dose. Now, we know that a blood thinner is an aspirin. We know that an aspirin-like substance called siloxylin will cause a problem. And they decrease the capacity of joint spaces to heal themselves, so they can become much worse, but they also will break down the wrapper, that myelin sheath. So take a look at what you're doing. It's real simple. Go to drugs.com, put it in there, and see what the potential side effects. How about exposures to toxins? What am I talking about? Toxins? Well, alcohol, any kind of drug abuse, chemotherapeutic drugs. We talked about heavy metals, mercury and aluminum and arsenic and even nickel. We have to rule those things in or out. Family histories of neuropathic problems. Now, does that mean that it's a genetic pass-through? No. It means that often if we eat like our family eats, if we do the things our family did, if we have lack of something that they had lack of something, then the chances are we're going to be predisposed to other types of situations. Now, how about lifestyle factors? Smoking, the residues of that, diet, physical activity. What do you do for work? Where did you live? If you lived in upstate New York, near Buffalo, I'm going to ask you things like, how long were you there? Were you ever exposed to whatever? Did you drink water from the artesian water system? Why? Because there's 13 toxic waste sites that are embedded in the water system in that end of the world. Did you grow up in Buffalo or in Pittsburgh? Why? Because the production of steel from Bethlehem Steel. Why is that a problem? Because they use coal-burning fireplaces that produce the most deadly toxic form of mercury called mercuric oxide. So all those things are important that you ask questions. So the physical exam, when testing reflexes and testing muscle strength and examining the skin for ulcerations and changes in texture or tone or color, how about balance? Can you stand on one foot? Can you stand on both feet together with your eyes closed? Testing the ability to feel light touch and pinprick and vibration and temperature sensation. How many of your doctors do that? When a patient comes into our office at the Roselle Center, we do all of those every time if they're complaining of any kind of peripheral pain, and particularly in the legs and the feet and so forth. You have to find out. Plus, testing everything. There are tools like, it's called a 128, if I remember, a 128 hertz tuning fork. That's the ones that we have in the back. I should have brought one out and showed it to you tonight. At least for your vibrational perception or thin fiber test. We got to find out where it's coming, light touch and so forth. That'll show up things as well. And so here's the deal. You have to run certain tests. We have to run blood tests. We're going to run what? We're going to run A1C hemoglobins. We're going to run, as we've said before, that's the average of 3 months of blood sugar in your blood cells. How about vitamin B2, B1, folate, vitamin E deficiencies? If those guys are low, your nervous system is not going to work. B12 as well. Thyroid disorders, particularly if it's an inflammatory reaction, if it's an autoimmune condition. Remember we said earlier, we talked about liver and kidney function? Toxic substances, heavy metals, provocative challenges, or at least minimally a hair analysis. Your doctor runs a blood test. Well, there's nothing in your blood. It's because within 24 hours of being exposed to any kind of heavy metal, your body has gotten rid of it. It absorbs it into tissue and it starts accumulating. Is there any inflammatory level? Is there vasculitis? Are you having all kinds of problems with, with these lousy engorged veins in your legs? How about Lyme disease? In today's world, we have to check that. Unfortunately, HIV, hepatitis, things of that nature. All those things have to be ruled in or out when you're talking about a distinguishing between a regular nerve problem and a peripheral neuropathy. There's even things like Guillain-Barré syndromes. There's something called tarsal tunnel syndrome. We talk about carpal tunnel syndrome. Well, in your feet, you have the talus and the calcaneal bones, and nerves run through them. So you have something called the tarsal tunnel that can show up. Then we can do things like electromyograms. So we're going to put little stickers, and sometimes we have to put pins in to find out whether or not you're getting transmission from one nerve impulse to the other. So there's tons of things that need to be done. You have to make sure that you have a doctor that understands what they are, besides just sending you out for an MRI or a CAT scan or anything like that. If you know what you're looking for, if you know how to distinguish the difference between a healthy system and one that's not healthy, but you can't do it just by, well, I hurt this and I have none of this. Okay, let's send you out for an MRI. Unfortunately, your insurance companies will accept that type of directive, but it doesn't do you any good because there is no distinguishing features. When we spend an hour, sometimes an hour and a half on an initial consultation and examination, we're trying to find what's really triggering this thing and where it's coming from. But determining the origin of pain, neuropathic leg pain, is to determine where it's coming from and then subsequently how to treat it effectively. So detailed history, as we've said, a physical examination, diagnostic testing of all sorts, physical examination that may involve a neurological platform, as we touched upon just a little while ago. And then at last resort, an MRI or a CAT scan. But then you have to distinguish, can this be turned around? If you do the job the right way, and when I say do you do the job the right way, I'm talking about your doctor, your physician, your healthcare provider that is supposed to be giving you, this is what it really is. Neuropathy is devastating if you don't get to it because it can cost you your leg. It can cost you your leg. How many of your docs will raise your leg up and then take your foot and push it back like this? If they haven't done that, they haven't done a basic rudimentary test. It's called a straight leg test, a straight leg neurocompression test. It differentiates sciatic nerve pain from other pains. You have to do at least that test to see what's going on. So we need to distinguish what's going on. So how do we look at a sciatic pain? What are other things that you can do? How can you say, hey, I think I got this? Well, if the leg pain is accompanied by lower back pain, stiffness, or if the pain travels, if you will, starting from the spine, it's in the spine, it's likely a sciatic pain. So what can we do to distinguish? What can you do to begin to figure it out? Well, how about just sitting in a chair and slump your shoulders forward? Okay, so what you're going to do, if you watch me right now, right, I'm going to sit in this chair and then I'm going to drop my shoulders forward and I'm going to kind of bring my head down to my chest like that. Now, if I do that and then I slowly raise the leg up, that hurts. Okay, slowly raising that leg up, that hurts, where I've got my pain. And it causes a sharp, zapping, zinging type of pain, if you will, or it increases the pain. It's probably sciatic nerve pain, but it's coming from probably at that point a disc or a stenotic pattern stenosis. Now we got to find out which. And as long as we know, we can fix it. The test helps differentiate between a spinal pain and a piriformis syndrome. A piriformis is a muscle that crosses over, if you will, this area right here. This is called the sciatic notch. This is where the nerve actually comes out. And there's a muscle that comes from this part of the sacrum and comes over and attaches to your leg. But sometimes that nerve goes through there and it gets dinged. And if that muscle's not working the way it's supposed to, you're going to hurt. You're going to hurt bad. So why don't we figure out what to do with that thing by differentiating where it's coming from? Because if you can't differentiate it, you can't fix it. Wouldn't it be nice to fix things instead of guessing at it? Wouldn't it be nice to get yourself out of pain instead of having to suffer continually and taking how many different medications and so forth on an ongoing basis? Wouldn't it be nice to have your life back? So how many of you got hurt during this lousy snow we've had recently? How many of you were out shoveling and all of a sudden you're sitting there right now and you're listening to this program and your feet are tingling, they're numb? Could it very well be that you overdid it a little bit? Maybe. Could it very well be that you hurt yourself? Maybe. Is it suddenly, oh my God, I have neuropathy? Well, it could have made it worse because you are diabetic. Could have made it worse because you've already had the deterioration and breakdown of that system. As we get through the program today, in the last part of the program, I'm going to give you a couple of things that you can do to help yourself and clean your act up a little bit so you can begin to heal. Wouldn't it be nice just to heal so you can enjoy your life again like you used to? Your body is completely capable of resolving virtually anything that goes on with it. We're the problem children. We're the ones that are going to stop the healing process. We're the ones that, make life much more difficult for ourselves. So if that's the case, I don't know about you, but I'd sure like to know about that. And I'm going to show you that. I'm going to show you exactly what needs to be done. I'm going to show you how to clean this mess up and what you can do to take control of your own health. Remember Ageless Health? Health is a do-it-yourself program. That's me. I wrote that for you some years ago. It's still available. I think we still have, go to agelesshealthstore.com and you'll find it. But look, this is in your hands, my friends. This is another one of those things that you can be your own partner in resolving things. When we come back after the break, I'm going to get into very specific things that you can do to help yourself, make life a little bit better for yourself. We're going to list them out. You're listening to Dr. Tom Rosell. This is Ageless Health. We're live, giving you the best information we possibly can. Don't go away. I will be right back. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Rosell. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Rosell Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Rosell and the Rosell Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Rosell's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomrosell.com/education. That's drtomrosell.com/education.
This is Dr. Tom Rosell, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. You're listening to Dr. Tom Rosell. This is Ageless Health. And what a night, right? What a day, what a week, what an amazing, oh my God, where did that snow come from time in our existence. So here's the situation. If you got hurt, now's the time to fix you. If you're putting up with it and limping it around, it's just going to get worse. It's just not muscle. Muscle problems go away pretty quickly. You can take magnesium glycinate for that and begin to stretch a little bit, and you should feel a whole lot better. But how many of you are shoving your face full of sugars, sodas, black teas, coffee, all kinds of things, sugar, sodas, coffee, black teas, fresh, fried foods, fast foods, alcohol, gluten, additives, GMO products. All those things cause the body to break down, and your nervous system gets kicked right in the pants on an ongoing basis. Look, if you know you're in the process of neuropathic problems and you don't want to see yourself lose toes, you don't want to see yourself lose a leg or lose your eyes or anything like that, wouldn't it be nice, wouldn't it be a great decision to begin to clean your act up a little bit and find out what that A1C hemoglobin is actually doing and saying, or your liver enzyme called LDH? Those things show up. And then inflammatory markers as well. Look, we've gone through a lot of different problems over the last several years. Some clotting formations occur. You can find out by doing something called a D-dimer and see if you're getting that low-level blood clotting. But vitamin B complexes, particularly thiamine, will work quite nicely to decrease the inflammatory response. Things like, berberine. So go to our Ageless Health store, and Biotics Laboratories is one of the labs that we use. We use actually 25 different laboratories in our office. Biotics Laboratory has a basic B, and they have Bio B100, and they both have pretty good levels in different forms of the B complex that you need. So what I would do, I would encourage you, get those and start taking maybe, but the basic B, take 3 a day, but don't take it after about 6 o'clock at night. The Bio B100, take 2-3 times a day. It's not going to hurt you. They're ionizable form. They transport really easily. B complex is a water-soluble vitamin, and you'll urinate out what you don't use. Get berberine. Berberine will decrease the inflammatory cascade and destructive process that is a result of high blood sugars and diabetic patterns. It makes a difference. It also decreases the pain load. You want to begin to restore and fix your life. Now, things like, if you will, and I don't know if you can get it, but you can check it out. It's called Repair Guard. And Repair Guard has high levels, 1,000 milligrams of quercetin, one of the best anti-inflammatories that you can get. So what would I do with it? Take 3 to 5 a day. It's not going to hurt you, but it'll help dramatically decrease your inflammatory response. Now, remember, you're not my patient, so I'm not going to recommend things that are going to cause you any issues. They're straight up vitamin levels and so forth. Vitamin C. You want to make sure that you take vitamin C with bioflavonoids. Again, you go to Ageless Health Store. All these things can be found there. And start taking things that will help you. Start laying off of the what. Start laying off of the garbage that you put in your system, the alcohol that you put in your system, the sugars that you're eating like candy, right? And fast-acting carbohydrates like cookies and cakes and brownies and pies and so forth. Look, my friends, you can turn your life around anytime you want to. We're dedicated to do that on an ongoing basis here at the Roselle Center. By the way, if you'd like to have a short, brief, free consultation, if you're in the Washington metropolitan area with one of our doctors, go to the website and you'll see at the top of the toolbar, it says free consult. Call the office, tell our staff that you'd like to talk to one of our doctors for a short 20-minute consultation. Call now, give them a call, let us know that, we're happy to do it, by the way. This is us being us, trying to serve you. We're trying to make sure that you have every opportunity to turn your life around. Anything short of that, anything that's outside your hands is not what you should be signing yourself in for. If you go to a doc and they tell you, what do you expect for your age? I don't know about you, but I'm trying to figure out another 30 years on this planet and try to get things really to step up and do things better. Get my book, Ageless Health, Health is a Do-It-Yourself program. You can download it. It's on audio version. You can get the CD for yourself. We still have them. Call the office or order it right there online. I think you're looking at it now. Ageless Health, Health is a Do-It-Yourself program. Look, my job is to give you as much data, as much information as I possibly can, so you can turn your life around, so you can be better than you've ever been before, that you don't have to sit there with tons of, oh my God, I can't do anything anymore. Let's recap a little bit. Let's go through some of the things that you really need to know about, things that if you put them aside, it's shame on you. And when you have the tools to be able to fix something, you need to fix them, right? We said that neuropathy in the beginning was, it refers to damage to the peripheral nerves. Sciatica nerve pain specifically involves pain originating from a bundle of nerves called the sciatic nerve. Remember, we said 5 nerves, not just 1, 5. We said neuropathy can result from various conditions. We said that includes diabetes and infections and toxins, whereas sciatic pain is caused by a nerve that's being pinched either by the movement of the vertebrae out of position, or it's being pinched because of a herniated disc, or it's being pinched because of spinal stenosis and narrowing of the canal that the nerve comes out of. So those are distinguishing features. The symptoms, both conditions can cause pain and tingling and numbness, but neuropathy symptoms are often caused by and are presented statically, right? They don't change. Position doesn't change them because the deterioration of the covering, the myelin sheath, is what's being involved. It doesn't make any difference what you do positionally. It's still going to deteriorate. It's still raw. It's still irritated. Remember, we said we have to look at a lot of things, your blood sugar levels. We have to look at what heavy metal exposure. We have to look at what, things that you're drinking that are bringing it down. A alcoholic neuropathy is a really big deal. So if you're drinking all the time, you may have a neuropathic problem from your drinking. If a diabetic situation occurs, you're destroying the outer wrapper around that nerve. So look, if a sciatica is there, it will fluctuate with movement and physical activity. Location, neuropathy can affect all the nerves in your body, but we're talking about your legs right now. We're talking about your feet right now. We're talking about your buttocks right now. Sciatica specifically affects the lower legs. If it's not in your legs, it's not sciatica. It's not down the back of your leg and into the side of your leg and your foot. It's not a sciatica. It could be another nerve, but it's not a sciatica. So we have big differences that we have to really be aware of, right? The tingling, the burning, the stabbing, that's going to be neuropathic pain. Worse at night. Sciatica never goes away, but it's often worse at night. Numbness, balance issue. You can't stand up, can't feel your feet, don't know where you're at. Sciatica, sharp, stabbing, shock-like pain, history of back injury, things of that, those kind of things. Those are the things that show up. Look, if you knew you could fix it, why not, right? If you knew you could dumb it down, why not? Start out with watching the stuff you put in your face. The sugars, the sodas, the coffee, the black teas, the fast foods, the fried foods, the alcohol, the gluten, the additives, the junk. And maybe your body will start working again. Start realizing that you've got to move. Start realizing that things just don't show up, that it just didn't pick on you. So quit looking for excuses. Let's do something about it. Let's get you fixed. Remember, on February the 18th, coming up pretty quickly now, a week after this one coming up, we're going to be here at the Roselle Center for Healing. The professor, Dr. Harlan Browning, and I will be tag teaming. We're going to be talking about the causes and treatment of low back pain and all kinds of leg pain, because there's more than just sciatica. And we're going to show you what to do with it. So join us. Make it happen. If you're in pain, why suffer? If you want to know what to do about it, we're going to tell you. I keep telling you things on the program. What did I do today? I give you all kinds of things to do, right? Told you that there's some vitamins that will help you. I told you to quit eating the garbage in your system. I told you to get out and go for, stretch a little bit, go for a walk, and quit, being static, not moving around, not doing anything. Because you don't want to lose your feet. You don't want to lose your toes. You don't want to lose any of that stuff. So let's make it happen, my friends. You have tools that I've given you right now that can make a huge difference. If you ignore them, you're going to be in trouble. If you ignore them and think that it's somebody else that's going to take place, you got a problem. Because that somebody else just might be you. That somebody else just might be you. So I don't know about you, but I don't want it to be me. That's why I exercise on a regular basis. That's why I stretch every day. That's why I really watch everything that I put in my mouth. In my house, we cook. In my house, we eat well. In my house, we make sure we're taking vitamins. In my house, we don't ignore things because it's too late when it really comes back and bites us. In my house, we embrace a concept that we're the cause, but we're also the cure. And we can reverse and change virtually anything at any moment, anytime. How about you? You Ed? How about you? You willing to make a difference in your life? How about you? You're an excuse maker or someone that wants to fix it? Remember, you're the cause, you're the cure. So why not do what it takes? Why not use people like me? Send me notes, ask me questions. I'll respond to you. I'll make sure that it happens. We're coming up to the end of the program. I love doing this for you. We're here every week with brand new information on an ongoing basis for one reason only. I love you all. You have a great day. Take care. See you soon.